Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Hello and welcome to this episode of Bristol Health Cares. I am Kurt Barwis, your host. We have two exciting and amazing guests with us this morning, Dr. Boschman and Dr. Brady, both from the Beakley Breast Health and Wellness Center at the Bristol Hospital. Good morning, welcome. Dr. Brady, why don't you start off and tell us about yourself?
Well, I'm a breast surgeon and I've been doing that work only for probably about 25 years. I came to Bristol, to Beakley 3 years ago, and I think I died and went to heaven in this position.
Aww.
We have the most wonderful community. We have the most wonderful facility, and the people who work there, I think people are constantly amazed that Bristol, Connecticut would have this amazing breast care center. And we are amazing.
And we were very fortunate to get you. We really were. Dr. Boschman, you're the newest member of our family.
I am.
Tell us about yourself.
Well, I'm originally from Colorado and just moved out to the Northeast about a year ago to finish my training. And now I'm here in Connecticut and I'm excited to help take care of people in the area.
So what made you, how did you find Bristol Health and what made you pick this place?
I was looking for a community hospital that really took good care of patients in the community, and somebody told me about this position, and I came and met everybody here, and it was really what I was looking for, in that everybody's very friendly. They say hi to you on the elevator. You can tell that the patients that live in Bristol want to come to Bristol Hospital. And yeah.
So Dr. Brady, you've had this incredible career. And so I think, if I'm not mistaken, you're going to go on to a different part of your life pretty soon. Is that right?
That's the plan. So next I have, who's counting, 5 more days of my career as a breast surgeon. And then I will be retiring from that and actually getting married shortly thereafter. And
it's so exciting.
I know. I've never been married before, so I'm very excited about it.
You have smiles from both sides of your face. I could see it. It goes all the way across. Yep. So we're really excited for you.
Life will be very different, but it has been wonderful. And I tell my patients all the time, if somebody came in and said, sorry, you're going to have to work another 20 years, I'd still be okay with that. I love my job. It's just you get to an age
where... Could that be anybody? Could I come in and say that too? Yeah, sorry.
We get to an age where you just know you got to, when you're healthy enough to do things, go do them. Yeah. So want to do a lot of traveling and some other things.
So like I said, you built this incredible reputation. So talk to me a little bit about what role you played in the recruitment of Dr. Boschman.
Well, first of all, we took all the CVs. And there are wonderful breast surgery candidates out there, no question about it. But it's all about the personality. So the credentials and the qualifications, they're never an issue. We had quite a few candidates came through. She's magic. Everybody loved her. Everybody loved her. So that personality fitting into Bristol Health and into the Beakley Center is the most important thing. The qualifications are, I won't say that she's not remarkable in her qualifications, but if we dig down, we can find people with the qualifications on paper. It's the personality that makes it.
Yeah. So you're comfortable, because I think what patients want to know, because patients develop such an incredible trust and bond with their breast surgeon when they have that issue. So you're comfortable telling patients this is a good choice at this point.
Oh my gosh, it's been so fun because since she's been here, I will be seeing patients in the office and we'll walk down the hall and I'll see her at the computer. I'll say, there she is. And so the patients will be looking and Dr. Boschman jumps up and comes over and shakes their head. Oh, it's going to be great.
That's incredible.
Not worried.
So this was an easy decision for you, even though you came from Colorado. So
Yes.
I guess the weather's about the same, right?
Yeah, maybe a little less snow and a little less sun.
A little less sun. Okay. So 5 more days, and then you're at the helm of the ship.
I'm here.
The Beakley Breast Health and Wellness Center, which, by the way, shout out to the Beakley family and the Beakley Corporation people for really doing an incredible job raising funds for keeping our center and our complete environment for breast health the state of the art. I mean, so talk a little bit about that.
I can't say enough about the Beakley Corporation, and it is our local benefactor. That word isn't even strong enough. They're an incredible group. They are so passionate about what they bring to the Beakley Center. And people can't believe, they walk into Beakley and they're thinking, well, this is little Bristol Hospital. This breast center is as good as any in the state of Connecticut and beyond. And it is because of Beakley's tremendous support. We need something, we get it. We have a state-of-the-art stereotactic biopsy table that's 3D that many places don't have in the country, never mind in Connecticut. And it's just, if we need something, they come through, they step right out, let's get you that. And they are so passionate and wonderful. Just love working with them,
It is great. I mean, and then beyond the technology and the environment, which is extraordinary, they help build that center. You have a team that goes beyond the two of you, right?
Well, and this is where Dr. Boschman is meeting everybody and learning, but the reason why I came was because of the team, too. You can't be a breast surgeon and work by yourself. You have to have strong pathology, radiology, cancer care. So it's plastic surgery. We have Dr. Toto. Yeah. So we have just the most incredible array of people who are really talented. And again, people think, Bristol, how'd that happen? Well, it just plain does.
It for me personally, it's such a sense of pride to have patients to come there and then talk about, because I meet everybody in the elevator and people are captive in the elevator. So I love talking to people in the elevator because they have no choice but to talk to me. And I mean, I know when they press C, they're either going to go diagnostics or the breast center. And people they come out of there and they feel really good about the experience. So in fact, I had a patient who had just seen you going back about a month ago and was coming out the front door with their husband, and I had referred her to you. And they stopped me, and I actually had to go to a meeting, and I think I was late by about 15 minutes because they were just talking about the experience in the center. It's really good. So talk a little bit about the future. What's the future hold for us in terms of breast cancer, breast health?
There are a lot of advances in breast cancer right now in terms of medical treatment. If I don't have a job someday because there's a pill to treat breast cancer, that would be amazing. In terms of the Beakley Center in particular, one of the things that I'm looking forward to doing is starting a high-risk program and following women who are at a higher risk of getting breast cancer. So that journey, how does that journey begin? I mean, aside from connecting, hopefully a primary care, connecting with a patient. I've seen a lot of, especially very close to me, individuals that aren't ready for their first mammography at 40. They might be 30 and they've experienced, breast cancer. So how do women think about that? Is it okay to start to have that conversation when they're what age? I don't think you can really be too young to start talking about breast cancer. We don't normally screen women younger than 40 unless they have a really significant family history. But usually women get connected with us through either their primary care doctor or their GYN in talking about any family members that might have breast cancer or other cancers. And then they come see us and talk about how we can hook them up with screening by imaging, or just having a conversation about what they can do to decrease their risk.
How much does this, I hear a lot about genetic testing and the evolution and the precision in which they can start to predict someone who's at high risk. Talk a little bit about that. Is that true?
So genetic testing is really important for identifying patients who are high risk, but only less than 10% of breast cancers have a known genetic mutation. So it's also important to just know if there's cancer in the family.
So if there's cancer in the family and you have young adults, female adults, it's time to have that conversation and at least tell your primary care physician, your OBGYN, whatever, and start that discussion and awareness. That's really important, I think, for people to understand. Is there? It seems to me, maybe it's just because I'm getting older, but it seems like the incidence in younger people seems to be more than it used to be. Is there anything to that? Maybe it's just the people around me.
I haven't seen an increased incidence of cancer in younger people, but we are getting better at getting people to screening. Yeah. So we're seeing a little bit more cancer.
Yeah.
What do you think?
I think that it's my colleagues in other breast centers will also say we're seeing these young people, and I think there's enough information out there so that the younger people are much more aware, because those are the folks that are at risk of being not appreciated maybe by their doctor because it's so unusual. So there's a lot more education and awareness out there. I don't have the data at my fingertips, but it does seem like we have a lot more going on as far as cancers and maybe it's going to be environmental when we get it figured out. Certainly genetic for sure. Yeah. We can determine those folks, but there's a lot of environmental factors too that we haven't even scratched the surface on. So I think there's a whole lot more to learn.
It's interesting when I think back when I arrived 17 years ago, almost all the focus was funding mammograms and screenings for individuals who couldn't afford them. And in that, in the 17 years, we've seen the insurance coverage in Connecticut has grown, and, there's so many more people that are covered by insurance. Even if it's Husky or state Medicaid, 25% of the population is covered by state Medicaid. And yet there are still individuals that come in who don't qualify for Medicaid and don't have insurance and don't have the money to pay for it. And I think what the viewing audience needs to know is that we still have those funds, so there are still funds available in most institutions, well, especially in ours, so that if you can't afford it and you have no means, we can do the screening, and we actually have, in our foundation, we have the funds to do that screening.
And that's another shout out to the Beakley Corporation, because we have had so many wonderful, it's October, Breast Cancer Awareness Month, but we've had so many funding opportunities that have been amazing between golf tournaments and designer bag bingo and all kinds of things happening.
That is the rage, though. Everybody talks about designer bag. There are never any tickets for guys to go to that. Right?
That is not true. We probably had about 10 this year. So next year we'd like to double that.
They're hoping to get a bingo pocketbook for their spouse for Christmas, so they don't have to spend the money on a really expensive one. I think
nice bags, and there were some winners in that group.
There's no question. It really is a good time. And as you say, there's a tremendous amount of awareness and fundraising and engagement by so many. And when we go over to Beakley Corporation, when they present us with the check or tell us what their fundraising activity is, the energy level in that place, I have no idea. It's got to be something in the coffee over there. You'll be there soon. Have you not been over there yet?
Not yet.
Not yet? Oh, you'll see what I'm talking about. And when they do something exciting, they ring this bell, this huge bell in the hallway. so exciting. But again, very special people. So then, tell me a little bit more about how somebody accesses the pathways. Somebody who has a question or a concern, because we have like a little resource area in the Beakley Center, right? So there's computer terminals where they can access information, or they come in and just ask questions. There's a navigation person, right? Let's talk a little bit about that. Like somebody who's maybe thinks they have a lump or they felt something. What's the first step? What do they do?
Well, that's an excellent question, and as Dr. Boschman said, our biggest feed will be from primary care and gynecologists. That said, as far as risk assessment, one of our strengths is when people come in for their screening mammogram, our technologists will ask a series of questions that will identify sometimes some high-risk people who maybe didn't know they were. So we have that opportunity. Everyone who comes in to see the breast surgery side for whatever their reason may be, maybe a lump or nipple discharge or abnormality on their mammogram or whatever, we have a risk assessment that we ask them. So we always take care of business, but at the same time, we can identify who's at high risk. And so to make those opportunities and to fine tune that program and make that really a strong entity, that's one of Dr. Boschman's passions, as she said. So it'll be fabulous.
So what I hear you saying is, if you have any concern whatsoever, pick up the phone and call or come in, and there's someone that's going to be there to help you. And that's the key, right?
So our nurse navigator is Lori Santo, who is fabulous.
Yes.
Our medical assistant is Marilee Fontanez, who's also fabulous. And so the
She was up for Employee of the Year.
Yes, she was.
And
up
I
for
saw you
Employee
at
of
the
Year.
celebration.
Yes, and
Unfortunately,
I think
she didn't get it.
No, but she did in my book. So she's definitely a winner. So we have a team that's just so incredible. I mean, as I leave, this place is better than when I came.
It is.
Might be worth a bonus.
Okay, we can talk about that. but no. What you're saying is absolutely true. It is a lot better than when you came, and your leadership, your engagement. I mean, the fact that you moved into the community, and I would see you at the farmers market on Saturday mornings talking to people. That speaks volumes for who you are and your career as a breast surgeon, and more importantly, someone who was taking care of the community. So, thank you for all of that.
Thank you.
I mean, truthfully,
it's been a privilege.
Yeah,
awesome.
It's been an incredible journey, and no worries, you're going to be fine because you're going to make your own mark, and you're going to get there, and it's going to be absolutely great.
I'm excited.
Yeah. So, did you move into the community too? Have you been to the farmers market yet?
Not yet.
No. Okay, I'm teasing.
Next year.
Yeah.
No more farmers market.
When I came 17 years ago, it was kind of like it was a requirement that I moved into the community. So when I got a realtor, and every time I was getting to like a line of like Bristol, Burlington, or someone else, well, no, we can't. There's really no houses over there. You can't look at those houses. so my wife was kind of like, well, okay, I guess this is what we're going to have to do. But honestly, moving into the community, it was like the best decision for us because we just. It's a really very much a livable place. I mean, and it reminds me kind of like where I grew up in Philly, but and most people think of Philly as a, not, they think of it as a big city, but I lived in a neighborhood that was very much, friends. We did block parties. We had fun. That's the way I see Bristol, and which is kind of unique about it.
It's been a great place to live. I've loved it.
Truly.
Loved it.
So then, so we talked a little bit about what's next, but maybe some of that we don't really know. Because it's yet to be discovered or determined yet.
Right.
And you said it earlier, it's like, maybe someday we're going to get to where you take a pill and, you're going to be doing some other kind of surgery maybe at that point. But do you think that's far away?
It's really hard to say. I think that there's a lot of research going into it right now. But for the foreseeable future, we're still going to need surgeons.
Yeah.
I think what's fun about what we do now is the aesthetics for breast surgeons are so different than they were for me when I started 20 years ago. So talk a little bit about the aesthetics, because that's the fun stuff that we're doing. Well, women will have their breast cancers and then they can still go to the locker room and nobody knows they've had anything done.
Yeah.
So there are some amazing things with that.
Yeah, please.
We've come really far in the last 20 years or so in terms of what the surgery looks like. And that's one of the reasons that I did extra training after residency in breast surgery, because I wanted to do a good surgery for curing the cancer, but also make it look really good. And we can now do these surgeries in what are called hidden scar surgeries. So you can barely see the incision, especially with a bra on. And I take a lot of pride in what it looks like.
That's awesome. I think I remember, because we used to have the survivorship thing at the E019 Center, and they would always have a speaker that would come, and there was someone who was kind of recognized, not just in Bristol, but in the country, who had a double mastectomy and was not ashamed of it, and actually said, well, I don't have any breasts anymore. And so she would say, well, I can be on the beach. But I remember seeing the pictures, and it was like scorched earth. And, and if you kind of play that forward today, there's nothing like that. And it makes you start to think, well, why didn't we do a better job back then? I mean, but it's the way we were trained, right? I mean, that's the way it was. But
well, I'd like to say that now there are many, many, many more females involved in the care of breast.
That's
Who
true.
am I to diss the guys?
No, it's for me personally, it's been an incredible journey. And when I was in Northern Maryland, and we set out to build a breast center just like Beakley, and we thought it would be a good idea to bring in, I think it was 10 or 11 women in the community who were community leaders who had had breast surgery and been on the journey. And then we visited like 12 different centers in Delaware, Washington, and Maryland. And it was extraordinary to see the disparities between what some did and what some others did. One of them, the women would go in and be isolated in kind of and they'd wait in a room in the breast center, like in a little cocoon, like without any contact with anybody else. And others, it was kind of wide open. And then the degree to which they had the expertise and the team was all over the place. And community outreach and education was very diverse. Not an easy task, though, having 10 breast cancer survivors design a center.
No.
It was not an easy task, but we did it. It worked. So anyway, any last thoughts for the viewing audience, messages?
Well,
Dr.
again,
Brady?
as we talked about Beakley, I have said that it's so hard without seeing it for people to realize how special that place is. I mean, it is beautiful.
Yeah.
Aesthetically, it's beautiful. And then it goes so far beyond that. So I guess my quest would be to have more people come get their mammograms and their imaging done and just look around. I could take a cup of coffee and go sit in that waiting area. I mean, the fireplace is lovely. The gowns we have these beautiful terry cloth robes that are warm. It is just a special
And a fireplace
place.
in the waiting area.
I
remember how hard it was to do that.
And that's just the tip of the iceberg and what the Beakley Center offers our patients. It's wonderful.
Let me tell you, Dr. Brady, like I said, you've just made this incredible impact on our community and our organization, and we're really going to miss you.
Well, thank you, but I would like to say, what am I proudest of?
And
What I'm proudest of the future. I am leaving this place so good. I'm so proud
and you are, but you deserve
Thank you.
a lot of love and attention for what you did, and hopefully you'll be part of our community for a long time. And we really do wish you a happy marriage, and it's so
Looking
exciting.
good so far.
And I also wish you a really good golf game in retirement too. So
That's going to be the hardest part.
that's-
But thank you.
yeah, truly, Dr. Potion.
I'm just really looking forward to meeting everybody and just meshing in with the Bristol family and getting to know the patients that you're leaving to me.
And I'm sure extraordinary outcomes. It's like what we've always delivered and will continue to deliver. So thank you both so much. This is Bristol Health Cares, and this show is all about you. So if you have ideas and thoughts and would like to see me host someone on this program, about in any area of healthcare that you're interested in, you can email us at cares@bristolhospital.org. Again, that's cares@bristolhospital.org. This show is hosted by Nutmeg TV. Nutmeg TV is an incredible resource for this community. They're here in Farmington. The production crew is amazing, and special thanks to them. And it's truly an organization that I think we should all support, public TV. So thank you again for joining us in this episode of Bristol Health Cares. I wish you all a healthy day and a wonderful future. Thank you.